Hi, my name is Mary Wong, and I am a TCM, traditional Chinese medicine practitioner and acupuncturist. And today, or this evening, this is my second live feed, and I will speak to you about the 2-week wait and the do's and don'ts and any myths that surround the 2-week wait. And my knowledge comes from my own personal experience, having gone through fertility issues myself, as well as the knowledge through experiences of my patients, and on top of that, just doing a heck of a lot of research. So here we go. I actually wrote this book called Pathways to Pregnancy, and that is coming out September. And one of the pieces of information that I had wanted to share with the world was about this 2-week wait. And what was interesting is when I started the book, when I started to write the book, I had a lot to say about it. But what was really interesting when I sent it off to my editor, what happened was that I didn't even realize it at first, but through the first edit and having to cut a lot of text, what happened was my editor took out the 2-week wait, and when I discovered that it was gone, I was like, whoa, you have to totally put it back in, because for any woman and couple that have been going through fertility challenges, the 2-week wait is like this huge hair-raising experience, and I think I wanted to address that. And I've never seen other books really address it, so I want to do that at length. So to make a long story short, in my book there is an more like a Coles Notes version, very important. And tonight I want to give you the non-Coles Notes version. And you're definitely free to ask me questions as we go along. I want to know for sure that I am being heard, so I hope that you can hear me. So please ask questions anytime. Well, so again, surviving the 2-week wait can be a big ordeal, and I find that having gone through it, the longer you have been trying, meaning month in, month out, and getting the no, it's very difficult and anxiety inducing going through this time period. And there's a lot of questions that I get asked every single day about what to do and what not to do. So I just want to clear the air so that you know what you should or should not do. So first of all, I have had a couple of patients in the past 2 days that are literally who have gone through a frozen embryo transfer from IVF, as well as having had IUI, so the turkey baster technique. So what do, right? Like from day one, like when you do a procedure, one of the first things that people wonder is like, oh my goodness, can I get up off the table and go pee right away? Because typically these are ultrasound guided techniques with a full bladder. And when they insert it in for insemination, that is, of course, the sperm, the fear is that the sperm will fall out. And even natural intercourse, the fear is that the sperm will fall out. Well, know that the sperm are dynamic, and in IUI, they actually shoot it right close to where you're ovulating, so there's less time for, or then less travel that there is required for the sperm, so the sperm won't fall out. And for IVF, these are embryos, and the fear is that the embryos may fall out. So I just want to clear the air and make sure that you know that it is perfectly okay to go to the bathroom, so going to urinate or even defecate. I've had some people who right after a transfer are like dying to go pee or dying to like have a bowel movement, because sometimes the medications have made them have like loose bowels or something. So do know that there's no issue with going to the bathroom right after IUI, IVF, having sex, any of that. Because I'm going to even say that if you try to hold it in, it might essentially tighten up your uterus, and that's not what you want when you're trying to conceive. You want like a nice, plush, relaxed uterus. So by all means, please go to the bathroom after a transfer, IUI, or sex. And secondly, there are people, myself included, that have gotten ill around the time of like an IVF transfer or an IUI. And again, there's a fear that, oh my gosh, I'm sick, I will not get pregnant this month. Well, it's actually also not necessarily the case. And in my personal case, the time that I actually got pregnant with my daughter, Zoe, I was like deathly sick. I'm a person who never takes pills, never got sick, and the only time I got sick was when I actually started having to go through IVF. And the only reason why I had to go through IVF was because I had blocked fallopian tubes. So my egg and my sperms, they did not meet. So IVF was my only option, our only option. So back to the story. Well, the time that I conceived Zoe, in that month, I had the worst cold of my life. I have never had colds like this, and I think it's probably because part of the procedure, they give you an antibiotic as a preventive. And when you take an antibiotic, what happens is it actually does decrease and suppress your immune system, making you a bit more susceptible to colds and viruses. So I actually see lots of women going through procedures getting colds. So for me, I was like literally coughing up a storm, sneezing up a storm, you know, right after transfer, and for like even up to after I found out we were pregnant and way beyond. And my husband thought there was, first of all, no way that we can get pregnant, and secondly, that there was no way that we would stay pregnant, because I was like hacking up a storm, and he thought I would just like spit the baby out. So do know that if there's a potential little baby in there, they do not get spat out. And I have another theory about this too, because when you actually get a cold, what actually happens is that because your immune system is a little suppressed, it might not be a bad thing, because when it's suppressed, what happens is then your body will not go into this fight or flight mode, wanting to get rid of the embryo. And there is a fear that, one of the fears anyway, is that there may be an autoimmune response to kick out an embryo if you've had like multiple miscarriages in the past. And so, you know, having a cold actually doesn't dispel that. Maybe it might in fact actually help it. So other things to dispel. So if you're a traveler flying, so for those of you that fly on a regular basis, I think it's actually not really a problem to fly, but there is a lot of myths around that. And really the studies that I've come across, it says that there's no reason that anybody should miscarry through flying. However, there is a higher incidence of miscarriages amongst flight attendants, and really what they see is that that's more in the way of the overall health risks from flying, not the flying itself. So they tend to work long hours, they tend to bend at the waist. What was it here? I'm going to look right now. More than like many times a day. I think like 25 times a day. I don't see it at the moment. And the other piece about flight attendants, oftentimes, then they have difficulty sleeping, or they have very irregular sleeping habits, which may impede receptivity. With regards to activity, that's like one of the top questions. What should I do? What should I not do? How much movement can I have? So if you're doing insemination, or if you're doing IVF, I find that people, when they're at different calibers of trying to conceive, so when you're trying to conceive on your own, there's slightly less worry about how much activity to do. And then you graduate that to IUI, and people tend to think that we might need to actually maybe like stay still more. But when it comes to IVF, lots of people think, oh my gosh, I need bed rest. Well, in the olden days, the doctors actually did say bed rest for 2 weeks, and now we know that it's actually bad, and there's been studies around that. And the studies in like 2013, I believe, they saw that in fact it actually is not so good, because then what you're doing is you're decreasing blood flow to your uterus, which is again not so good for receptivity and implantation. And so in terms of movement, I say follow your gut and do no harm, right? Like I don't think really vacuuming hurts, but if you think it's too strenuous for you and you stress about it, then I say don't do it, right? And it's a great excuse to get out of housework anyway. And in terms of like exercise, I say if you do IVF where they potentially hyperstimulate you, meaning that you've had lots of follicles and you're really bloated after the procedure, then that's definitely not a time to exercise, because you don't want to increase more water bogging in your system, which might slightly impede implantation. For everyone else, it's actually okay to do some activity. So I typically say, the day of like an IUI or an IVF, you want to probably just lay low and not do too much. The next day, probably okay to walk around. I have a lady that I always use as an example who ended up doing donor embryo transfer and out of country in Prague. And the first day and a half, she stayed in the hotel and just chilled out, got her meals and all that. But she was in Prague after all. So really at day 1.5, they went out, her and her husband went sightseeing. And with sightseeing, she said she remembered specifically at one point where she had a little cramp and had to sit down. She couldn't help it. And then when it passed, they went on and toured again. And what happened then was that they were able to conceive. She actually ended up with 2 girls, twins, and happy and healthy. So again, do know from that movement is fine. And in terms of returning to work, some people say, I want to take time off and not go back to work. And again, I say sometimes it's actually good to go back to work, because it has you not stay in your home where you might be Googling yourself to death and driving yourself crazy about trying to look for things like symptoms and signs of, oh gee, am I pregnant or am I not? And on that note, in terms of am I pregnant or am I not in the 2-week wait, it is actually very difficult to decipher if you're on any kind of medication like progesterone, if you've done IUI or IVF, because sometimes just taking those things have pregnancy symptoms. And so you can't really count on having symptoms or not having symptoms, because I've certainly seen my share of women who think for sure they are pregnant and they're not, and then others where they have 0 symptoms and they actually are. So please, 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 while you're fondling your breasts every single day, checking to see if you're pregnant, know that it's actually not the best indicator. Okay? Listen, I've been there, I've done it. And even as I tell you, I'm sure you'll still fondle your breasts, but that's okay. Just know that no matter what, whether you feel it or not, we're not quite sure where it's at. And really, you don't know until you actually do the physical blood tests. And on with regards to the actual checking for positivity, sometimes if the doctor says, okay, you're going to do a blood test on such and such a date, it's really best to kind of hold off, because what you don't want is a false negative. If you do it too early, it will read negative, even for those that may be pregnant. Some women automatically will show their HCG levels, which is produced by the developing embryo, but for some it doesn't really show up, so the blood test is the best way. Okay, so I have a question here that I want to answer, so I'm going to read it. different pathology. How is the result so different from a blood test a doctor orders and one done in a hospital? I'm assuming you mean the HCG levels done through 2 different labs. So when we get our HCG beta levels for pregnancy tested, it's true, they can vary, and I'm not exactly sure how, but different lab, different technician, so that in itself causes variance. So literally what you want to do is you actually want to stick with the same lab, because then you'll have more consistency. And that goes with ultrasounds as well. So for those people who get like monitored for cycle monitoring, during an IVF cycle or IUI, depending on a technician and doctor, sometimes the measurements of the follicles vary. And I've had people get upset when they say, oh, gee, it doesn't seem to be growing. And I say, you know what, sometimes ultrasounds can actually be 30% off. And, when I ask, was it a different technician? 99% of the time they say, yes, it's a different technician. So I wouldn't count on the numbers as the end-all, be-all. So again, number one is consistency, so stick with one place. Does that answer your question? Awesome. Okay, great. Let's carry forward. In terms of, back to returning to work. So some people return to work immediately because they do know that they're going to drive themselves crazy at home and will be Googling all the time and just hyper-focused on trying to get a baby in the belly. And then for other women, it's actually better to stay away from work. So you really need to know what your scenario is. Because if you're in a job that is a place of huge amount of stress or stressful and strenuous activity, then maybe that is the time to take some time off. So judge for yourself. There's no hard, fast rule. Some people take a couple of days off. Some people will say, oh, gee, I work from home. So good luck with that piece. All right, I see something else here. Doctor ordered was 4:10. Then at the hospital it was 3:30. Is that something to worry about? Okay, so again, I say it might be a matter of technical differences. So you want to get another result, perhaps through, well, definitely don't go to a different place. Go back to your doctor. And is your doctor a fertility doctor, or is this your GP that's sending you to a lab, an external lab? What are things to help my little bean stick? Okay. Okay, good question. So how do you help make the baby stick? Well, actually, I have a whole thing about that. So one thing, if you're not already doing so, is acupuncture. We know that acupuncture helps to, number one, decrease tonicity, meaning tension in the uterus. And one of the things about receptivity is that you want your uterus to be very relaxed. The other piece is that you want it to be highly vascularized. And in the first trimester of pregnancy, or even just trying to conceive in the 2-week wait time, you want to really increase the blood flow to your uterus, because that's what keeps it sticky. That's what is basically food and nourishment and oxygenation for the first trimester of pregnancy. So that is really, really key. And well, how do you do that? Laughter, we know, is definitely one as well, aside from acupuncture. So laughter you can do on your own. There's such thing as like a laughter yoga that you can actually YouTube if you want to go through that route. You can ask your partner or friends to tell you jokes, read funny magazines, watch funny movies or shows. But laughter is definitely healing for all. Okay. All right, let me answer this again first. What else? The other thing is, there's this whole weariness about, oh, gee, I have to be positive and stay positive in order for baby to stick. or to get pregnant in general. And I say it's really, yes, positivity is good. However, what I say is actually more important is to be true to your emotions, because if you're actually sad and anxious, what you want to do is acknowledge it and not just shove it down, because when you shove it down, what you're doing is suppressing emotion, and suppression of emotion will also increase that tonicity in the body, which again will increase tension in your uterus. When you have more stress in the body like that, then again your cortisol levels will go higher, then the energy will go more to where it's necessary for survival, which is not in the reproductive organs and certainly not your uterus at that time. So acknowledge your stress, and perhaps without judgment. And one of the worst things you can do is, when you acknowledge your stress, is to be stressed about being stressed. So just notice it, do not judge it, let it come in, let it go, and then maybe use gratitude. Think about what one thing you can be grateful for today, and you could use visualization technique or hypnosis. Some people download, there are meditation or hypnosis, self-hypnosis apps out there that you can download. I work with a hypnotist. Her name is Sean Gallagher. She actually has free downloads through her website, and you can contact her directly. And that's just Sean Gallagher. Okay, now let me see. GP is the one that did the blood test. Okay. Is HCG on the lower side of normal to be worrisome? At 5 weeks, only at 410. Okay. No problem that you're full of questions, because you're in the place of being worried, right? So it's not necessarily a worrisome thing. Everyone is different. I've had people who, you know, from day one, their betas are really high. Was that your first beta, the 330? Because some people on their very first beta is actually like even under 100, and sometimes the doctors worry, and I've had them say, oh gee, you know, get ready for a miscarriage, and I've seen those babies go to term. So I never go by numbers solely. I use it as a marker and go, okay, maybe that's something to work on. But everyone is different in the world, which includes a growing, developing little embryo / fetus. So sometimes they're a bit of what I call a late bloomer. Even though your HCG level should double every 48 hours, sometimes in some women what I find is that it doesn't necessarily do that. And when it doesn't do that, again, don't like freak out. You may want to, but it doesn't mean a demise. So let's say, for example, it's 3:30 and 48 hours later you go and it's like, you know, 5:50. Well, I see it as when there's a dynamic shift, perhaps they didn't catch it at the growth spurt. And maybe if they catch it like an hour or two later, you're going to hit that growth spurt and it'll normalize again. So don't panic and freak out and think that it's the demise that's coming through. Now, of course, there's no guarantees. So sometimes the more intervention we have, the more we make ourselves crazy. Left alone, it depends on the person, right? And when you say high risk, I'm not sure exactly what you mean, because there's lots of definitions for high risk. So maybe you could explain that. But in terms of HCG, as long as it goes progressively up, we're okay, typically. If it goes backwards, then probably not the best scenario. Okay. Second, I don't know what that means, but okay. Let me go on. All right, so back to the 2-week wait, about true emotion, your emotions. Oh yes, one of the things that is important is restful sleep. Yes, I think it's important to try to get as much sleep as possible. But the other reality is that if you're on progesterone, some women, myself included, is that it can offset your sleep habits, meaning that for some it actually causes some insomnia, but that doesn't necessarily deter you from having a baby or getting pregnant. Okay, but of course you're going to try to rejuvenate yourself as well as possible. Oh yes, this is a good one. Sexual activity. So people worry about, can I or can I not have sex during this 2-week wait? And there are actually studies out there, and there's some fertility clinics that will say no intercourse around IVF treatment, especially post-embryo transfer, leading to worrying about uterine contraction. However, that's not necessarily so, because there's also studies out there that say sexual intercourse is actually helpful, because there's the bonding between the couple is helpful, as well as the exposure to semen may sometimes increase conception rate. However, when people are going through fertility, oftentimes the last thing they want to do is have sex. So really, don't force yourself to have sex thinking that it'll help you to conceive. If you're not in the mood, don't worry about it. Don't do it. And when you're on lots of drugs, the last thing you want is like a man touching you. But that's besides the point. Okay. We talked about returning to work. Okay, here's what you said. Okay, first HCG was 45 at week 4, and it increased to 330. Okay, so there's an up. So what you do need to know is if it goes up again. And I don't know if your doctor has ordered more tests. And if it's just your GP, they don't really monitor you so much. They basically let you wait until week 12. If you've had miscarriages before, they typically monitor you a little bit more, or you might request it and see how it goes for yourself. If you are driving yourself crazy, then I would say go to the same lab, get the requisition, check the numbers again to see that it's more than double. Okay? But I mean, it is definitely more than what it was, right? So that's a good sign. Okay, I think that about covers it, right? I talked about amount of activity, I think. So high aerobic activity is probably not the best, but some walking is good. And like I mentioned, the Prague lady, that did not impede conceiving. So if there's anything else, I would totally welcome your feedback. And I'm just looking for anything else here. Coughing, sneeze. Oh yes, of course. Spotting. So some people see spotting, and spotting before even getting pregnant. So there's an automatic worry. Well, yes, some people know that it could be implantation bleeding, but if you have any kind of procedural thing, sometimes you just get spotting from that. And then also, if you're on progesterone, some people get spotting from progesterone. And when you're pregnant, people freak out when you get some spotting or even bleeding. And I see lots of women that go through pregnancy and actually get bleeding while they're pregnant, and have that not become a demise or a spontaneous miscarriage. What's common, again, is that you can get bleeding through irritation, especially like if you use progesterone suppository, or just extra suppository or extra progesterone in the body in of itself. It may also be because that you have developed a subchorionic hemorrhage, a fancy word for blood clot, and most of the time it actually poses no issue. The clot is between like the developing embryo and the uterine wall, and what you don't want is the embryo to detach. But most of the time what happens is that the clot either needs to get reabsorbed into the tissues, or it needs to bleed out. So better to bleed out. And so when you see the blood, it's actually not a bad thing, but you may panic, of course. I've had an instance where a woman was carrying twins and she had this like a blood clot like this big. So she thought for sure she lost one of the twins, and sure enough, it was actually just a giant blood clot that came through and out, which was necessary for the development of the babies. So I hope that's helpful. I think that covers a lot of it. Oh, okay. See, there you go. You're getting bloods every week for your blood test. Okay, perfect. So find out. But after a certain time, getting blood work doesn't help, because after about like 78,000 for your beta, there's no consistency on how much rise there should be. So really, it's again becomes obsolete and inaccurate. And what you want to do is wait for the 7-week ultrasound. I prefer 7-week over like doing it at 6 weeks or 6.5, just because at 7 weeks you should actually get a heartbeat. And prior to that, again, when you do it prematurely, people may panic and think, oh my gosh, I'm not seeing a heartbeat, so you know it's going to be a miscarriage. But yet, really, it could be that it just hasn't developed to the point of a heartbeat that is seen. And by the way, it's not really a true heartbeat. These are a coagulation of cells that starts to pulse. They become pulsatile, and as a unit over time, they actually become the heart, which is kind of cool, right? Okay, I think that is it. And if you have any more questions, please do ask. And if not, I would love for you to join me next week. And speaking to some people, including my patients, I think the feedback is that it'd be better to do on a Wednesday night, as Thursday nights could be like a night out. So next week, starting next week, I'm going to be doing video live on Wednesday evenings at 9:30 Eastern Standard Time. And please, please, please feel free to make a comment as to what you would like to have the topic be, and I would love to cover it, whether it's next week or the week after or some coming week. Okay, so I hope this is helpful, and have a very good evening, and we'll talk soon. Bye for now.